Okay. Good morning. Nathan, I think we're about to one connection. That way you can go ahead and introduce the webinar.
Okay, great. Good morning, everyone. This is Nate McConnell with the Construction Exchange. I'm the Director of Education for the Exchange. I just wanted to, briefly introduce you to Jennifer and Jose from Alcott HR. We really appreciate their time today, and I know this is a topic that is of very interest and great importance to everything that's going on. So without further ado, Jennifer and Jose, take it away.
All right, thank you very much. Obviously right now, most of the country, including the state of New York, is in the midst of its reopening phase, trying to get things back to the new normal. And so what we're trying to do today is just to go over some of the things that we're hearing a lot from our clientele, a lot of questions they have about reopening, how to transition, what are some of the requirements the state has for this particular industry, and just generally for employers, what's expected of businesses from a compliance standpoint, from a safety standpoint, in order to reopen successfully and compliantly. All right, so if we can go on to the next slide. All right, so in general, the three major topics we're going to talk about, specifically the New York reopening guidance. Some of you may be aware that recently the state has released guidance generally for employers and businesses to reopen, but there are specific guidances based on specific industries. And today we're going to talk a little bit specifically about guidance that pertains to your industry, to the construction industry. We're also going to discuss the challenge of dealing with employees that may not want to return to work, especially with some of the incentives not to return to work, such as the extra bonus to the unemployment benefit. And then we're going to talk about a little bit at the end about trying to adapt to what everyone's referring to as the new normal, because fortunately or unfortunately, there are a lot of things that we've been thrust into during this social experiment of remote work and what's transpired because of the pandemic, that some of these things aren't going to go away for a while. And so what we want to try to talk about is just some best practices and some ideas of what to do to try to prepare ourselves as business owners and employers in adapting to this new normal. You go next. All right. In case you haven't seen enough of our mugs up top in the on the presentation, my colleague Jennifer and I will be making this presentation today. At the end of the presentation, we are hoping to have enough time left over for you guys to ask any questions. We'll open up the floor to you guys to submit any questions to us, and we'll try to answer as many of them as we can. Those questions that we cannot answer, don't have the time to answer today, we'll try to answer you via email. You're going to have our contact information at the end of this webinar, and we're going to provide you with additional resources in case you have any follow-up questions for us. All right, obviously, as Alcott's corporate counsel, I'd be remiss if I didn't mention that what we're providing to you today as a resource is not to be construed as legal advice or tax advice. And as you guys, I'm sure, have been aware, things change daily. In fact, just this past evening, just yesterday, the Senate approved some changes to the PPP loan program that we're working on a alert for all of our clientele. And that's just another example of just like it's just a very fluid situation. So the information that we're providing you today is current as of today, but it may change. So we encourage you, if you have any questions, please feel free to follow up with us. All right, and I'm gonna turn it over to my colleague Jennifer, who's gonna talk about New York reopening guidance.
Good morning, everyone. So we're going to review the New York reopening guidance. Specifically, though, we are going to focus on the construction reopening guidance that's been provided by New York State, as well as the generalized guidance that is also applicable to the construction industry. So the first step in reopening, which you should have all completed by now, so if you have not done this, please make sure to put it at the very top of your to-do list. You need to develop a safety plan, which sounds very generalized, but fortunately for everyone, New York State actually put out a very good template for developing a safety plan. Usually, the templates aren't always great, depending on what they're for, but I highly recommend using the New York State Safety Plan template. It's available on the Forward New York website, and we'll also be sending out a PDF of that template after this webinar as well, so you can look forward to seeing that in your email. The thing I really like about the safety plan that New York State put out, sometimes we see when New York State puts out templates that they kind of go above and beyond what the requirements are, which is usually why we don't use them at Alcott, but for this one in particular, it follows exactly the guidance that's been put forward by New York State, the generalized guidance for all industries. So if you follow that safety plan, it does help you in ensuring that you're being compliant with the generalized guidance that's been put forth. It is 7 pages, so it looks a little overwhelming at first, but once you get started with it, it's pretty quick to go through it. So definitely take a look at that. You also, on the New York Forward website, you're going to want to complete the business affirmation form. And this is just a form that acknowledges that you are aware of the guidance put forward by New York State and that you agree to adhere to it. It is a requirement for reopening. At this stage, we're not seeing any audits happening in terms of the business affirmation form, but the risk that you put forward always as a business is, especially in this time, you could have someone who's a whistleblower amongst you who might report you to that COVID hotline that's very accessible to employees. So if you were to be reported in for not following the New York State guidelines, they would absolutely check if you've completed the business affirmation form, and they would also request a copy of your safety plan. So it's very important to have those things ready just in case, right? Now, when it comes to the guidance that's been put forth, a lot of it is common sense, and a lot of it is what we've already seen from the CDC in terms of best practice recommendations for protecting ourselves and our employees against COVID. Now, the number one thing that's listed on there is physical distancing. Which can be difficult in the construction industry, right? You want to make sure when possible that your employees are 6 feet apart if they're not wearing facial coverings. A caveat to this in the construction industry is if you're doing indoor work and the space is 250 square feet enclosed, you can only have one employee working in that space. Now, if you have employees wearing proper PPE and they have their cloth facial coverings on, you can be closer than that 6 feet. But if the employee has a job or a reason that they can't wear that facial covering, then you should be maintaining that 6 feet of social distancing and only one person in a 250 square foot indoor workspace. The other thing that's particularly applicable to the construction industry is only one worker allowed in tightly confined spaces if they're not wearing a proper PPE. And for construction, we're looking at elevators, any type of like hoist, things like that, where it's a much smaller area where someone would usually be. If you are using an elevator for any reason, make sure you only have one employee in there if they're not wearing their facial covering. And if you do have facial coverings that your employees are consistently wearing, then you want to make sure that you're keeping your employees to only 50% of the maximum occupancy. And that would be, the maximum occupancy like we see in public spaces that are on placards. That's what they're talking about when it comes to that. And then you also see those in elevators, right? It might say 10 people maximum in this elevator. You can only have 5, even if they're wearing their cloth facial covering. You also want to use social distancing markers at places where employees commonly line up or congregate. So that might be time clocks for you. If you have a specific area in your work site where the employees are clocking in, you need to take tape there's a lot of companies producing these like stickers that you can put on the ground, make sure that they're non-slip. Of course, we don't want any OSHA violations. And you want to mark out that 6 feet so that employees know where they need to wait in line. You also want to consider doing that for your health check areas, which we're going to talk about the health check or health screening areas on the next slide. So we've already spoken a little bit about the PPE. So as you all know, the employees are required to have face coverings if they cannot maintain 6 feet of social distancing. Those face coverings need to be supplied by the employer. If you have, employees that are using respirators because they do painting, or, welders wearing face masks, those count as the facial coverings. Those are, above and beyond a cloth face covering, of course. But you want to make sure that those employees still have access to the cloth face coverings, because they're not going to show up for work wearing their respirator or their welding mask. So they need to have that other option available to them when they're not wearing their normal PPE. And any face coverings do need to be supplied by the employer, as I already stated. However, if you have employees who maybe, they really want to wear their bill's face mask, that's okay. You can allow employees to use their own cloth face coverings that they bring in. Just make sure that they adhere to your dress code and adhere to your safety practices as well. So you don't want anyone wearing a cloth face covering that has something offensive on it, of course. And then there's also recently, last week, Governor Cuomo passed Executive Order 202.34. And what that means for businesses is that businesses have the right to deny entry to their workspaces for any vendors, customers who refuse to wear a facial covering. So that's important for you to know that that's available to you. And you should do that to protect your employees, because ultimately, what this comes down to is protecting your business from potential claims, as well as protecting your employee safety, right? And OSHA has come out and said, when it comes to safely operating your business, we've always had in place, right, that under OSHA, employees can refuse to work if they feel their workplace is unsafe. OSHA has come out and incorporated COVID into that and said, yes, that includes COVID-19. If the employee feels unsafe for a specific reason, not just generally unsafe, because we are hearing a lot of that, but if the employer is doing things like not following the guidance put forth by the CDC in New York State, allowing, clients and customers to come in without facial coverings, without maintaining the 6 feet of social distancing, if the employer is not providing facial coverings, you could have a claim of an unsafe workplace with OSHA. And if you are reported to OSHA for not following these practices, that's exactly what you'd have. So make sure that you are following these guidelines for that type of protection. Now, hygiene and cleaning is something else that's already been spoken about at length. It continues, right? So you want to make sure that you have cleaning practices in place. Now, specifically with the New York State guidance, there's specific elements that you have to follow. So you have to make sure that there's hand washing stations available for your employees. Obviously, depending on your circumstances, that might be difficult for you. There might not be running water in the site that you're working on currently. You might be primarily working outdoors. So when those circumstances arise, you also need to make sure that there's an alcohol-based sanitizer available to your employees. It has to be at least 60% alcohol in order to be considered effective against a COVID-19. So make sure that you have both of those elements available to your employees. You also want to limit the sharing of objects, which I understand could be very difficult depending on what type of machinery you're operating. You might have multiple people handling the same machinery, right? So you want to make sure that you have a cleaning in place for when you have a switchover of employees on a different machine, or if you have tool sharing going on, you want to make sure that there's sanitization in place for that. And specifically for construction, it does say in the guidance that if you're unable to use a sanitizing solution on a specific machinery due to the machinery degrading in some way, or it creating an unsafe element for that machinery to operate, then you can put in other safety procedures, such as requiring the employees to wear like nitrile gloves when they're operating the machine, and then disposing of them and having another employee come in with a new pair of nitrile gloves, so that you're trying to keep the area as hygienic as possible. You also have to maintain a cleaning log. Now, this needs to be, written on a piece of paper. You need to have the time that the cleaning occurred and a little bit of detail about what was cleaned. This needs to occur at a minimum of once daily. There needs to be, a cleaning of every workspace performed. And if it's an area that's frequented, you want to have more cleanings in place for that. If it's in an area where there's a lot of employees, it's a high touch area. For example, a bathroom might be somewhere where that would happen, or like a shared eating space, a kitchen space, something like that. In terms of communication, you are required to post signage for hygiene, social distancing, PPE, and cleaning protocols. So make sure that you have that posted around your work site. You can obtain these posters from the CDC. They're, very simple graphic posters that are easy to just print and pop up on the walls. You want to make sure that your employees are aware that these are requirements and that they're following them as well. And to that effect, you want to make sure that you're providing training to your employees. Now, this doesn't have to be something crazy, right? You don't have to sit down and, spend 4 hours going over how to wash your hands with employees. But you want to make sure that, if you're having team meetings or things like that, that this has been verbalized to the employees, that this is a requirement that they have, that they need to, wash their hands, maintain social distancing, wear their cloth face coverings, etc. And you also want to make sure that you are communicating in terms of contact tracing. Now, this is something we're getting a lot of questions about because it sounds very scary, but it's a lot simpler than it seems on paper. So really, when it comes to contact tracing, what that means is you are fulfilling your responsibilities put forward by New York State as an employer. If you have a positive case of COVID, you need to inform the local Department of Health. You just call the COVID hotline and let them know you're an employer, you have a positive case on your work site. You then need to use your visitor log, which we'll talk about when it comes to screening, and contact anyone who might have come into close contact with this person. And by close contact, we mean they're within 6 feet of the person for, a prolonged period of time, not just like a passing in the hallway, but they stop and have a conversation, or maybe they work in the same work cell. Maybe it's a salesperson who was on site at someone else's property. You are required to notify those parties. Now, something that makes contact tracing easy for the employer is, 1, your visitor log, and 2, you can ask the employee who has a positive case of COVID, who have you come into contact with in the last 14 days? It's really as simple as that. And then based off of what they tell you, those are the people you should be informing. And we'll talk about the communication aspect on the next slide as well. Now, your other obligation as an employer, which is a new obligation, is screening. So you are required to do daily health screenings of employees and essential visitors, not customers. Customers are excluded, but any essential visitors, so like a vendor coming in your door or something like that, you are required to do a daily health screening. And in that safety plan template, it does talk about that a little bit more in depth. There are requirements in terms of the certain types of questions you need to ask. It's really only 3 questions. Have you come into contact with anyone in the last 14 days who's tested positive for COVID? Are you currently experiencing symptoms A, B, C, D, or E? And is anyone in your household sick with COVID? It's pretty simple. You want to make sure you're asking those questions and that you're maintaining a visitor and employee log. So you need to keep a log that these people have been screened and who is reviewing the answers. And it doesn't need to be complicated. It can literally just be a list saying Joe Smith, the date, and that, Bob verified the results. Keep it simple. Now, if you have an employee who tests positive, we've spoken about that a little bit already, but we're getting a lot of questions about this from our clients at Alcott, because it's, people don't expect it to happen at their work site, but in all likelihood, most employers will have one case at some point or another before a vaccine is developed. So if you are notified that your employee has tested positive, one, you want to make sure if they're notifying you in person, send them home immediately, of course. If they're notifying you over the phone or whatnot, you want to make sure your first step is to clean and disinfect any areas that they've been in if they've been on your work site in the past 3 days. Your next step is going to be to communicate, right? You're going to start that contact tracing that we already discussed on the previous slide. The most important thing when it comes to communication around COVID is that you maintain confidentiality to maintain the employee's HIPAA rights. You don't want to go around and say, hey, Joe Smith tested positive for COVID. So and just making a generalized announcement, if you've come into contact with him, make sure you watch out for symptoms. You really need to be discreet about the communication. If an employee asks you, oh, was it this person? Your response should be, I'm not at liberty to disclose that information. And in all likelihood, our employees really like to be sleuths, right? They like to figure out what's going on behind the scenes, and you usually have a conspiracy theorist or two at your work site, right? So more than likely they might guess who it is. They can guess all day. You cannot confirm whether or not it is that individual. So just make sure you're maintaining that confidentiality when you're communicating. And the other thing you want to keep in mind if an employee tests positive is you want to notify them of their leave rights. As an employer, you have an obligation to do that. And if an employee tests positive, they are eligible for EPSLA. It's that new leave that the federal government put in place. It is in place until the end of 2020 at this time. So, we may see changes to that, who knows, but you do want to inform them that they are eligible for EPSLA. You want to follow the IRS guidelines in terms of making sure that you are executing EPSLA the proper way. There are guidelines on the IRS website for exactly what information you need to collect from the employee. For our clients at Alcott, we provided them with a kind of one-sheet request form that incorporates all of the required IRS guidelines, including multiple attestations, as well as supplementary documentation from the employee. If they've tested positive with COVID, they should actually have a quarantine order from the state, and they should be able to provide you with that as proof that they've tested positive and that they are eligible for EPSLA. And with that, I'm going to turn it back over to Jose, who's going to go over a headache we've been hearing about from a lot of our clients, which is employees who do not want to return to the workplace now that we're all reopening.
All right, thank you, Jennifer. So as Jen mentioned, one of the challenges right now that many employers are facing is employees not wanting to return to work, despite the economic challenges that we're all facing. Some people are hesitant to return to work for various reasons. One reason being that they're afraid of contracting COVID-19. Others may live with someone who's considered high risk and are afraid to return to work. There are some others that are currently collecting unemployment, and as many of you know, with the extra $600 benefit that many employees, any individuals that are unemployed are receiving, it's kind of an incentive to not return to work. Some of them are making more money on unemployment than they are, than they were when they were working. So we're going to talk about some of those challenges and what we can do to mitigate that. All right, so you're going to notice a key point throughout this presentation when Jen was speaking, when I'll be speaking, and what we're going to talk about next is communication. Almost with everything we're going to talk about today, communication is very key. So if you have an employee that doesn't want to return to work, the first thing that we should do is start a conversation with them. Ask them why don't they want to return to work? What are some of the specific concerns that they have? Some might be what I mentioned earlier. It might be that they're concerned that the workplace is not safe. It might be that they're just generally afraid of contracting COVID-19. Some of them, it could be economic, that they're collecting the unemployment, as I mentioned. So what we want to do in our communication with employees, it's generally speaking, it's best practice once you're reopening, especially if for those of you that did take advantage and were fortunate enough to obtain a loan through the Paycheck Protection Program, the or PPP for short, there are some requirements. Some of it is changing, but generally speaking, you do need by some point, currently June 30th, you are going to need to um, uh, return your full-time equivalents, up to where you were at before the pandemic, whichever period you use as a measurement period. Now, that being said, if some employees don't want to return to work, it's going to be tough to reach that number. And so what we want to do is best practice to anytime you're gonna offer to bring employees back, it's best practice to put that in writing for several reasons. One of which, as we explained, is you want to explain to your employees what have you done, what's everything that you've done to comply with the reopening guidance, and then some, in order to make your workspace safe. So, for example, what new cleaning procedures are you implementing? Do you have a new visitor policy? How are you enforcing social distancing, if possible, in the workplace? Are you providing face coverings? What other PPE are you providing? Are there going to be changes to shift schedules in order to minimize the number of individuals in a location at the same time? What screening are you going to be implementing, et cetera? So these are all things that you want to communicate with employees, especially those that have a concern of returning. And the reason why they don't want to return to work is a health concern. Then a lot of times this communication is going to go a long ways in making your employees feel safe and for them to understand everything that you're doing as an employer, as a business owner, to not just comply with what's required of you, but to make sure that your employees feel safe and can do they can fulfill the terms and conditions of their employment without worrying about safety in the workplace. Okay. Now, as you're talking to the employee with regards to their returning to work, again, if they indicate that they don't feel comfortable returning or don't want to return to work, we want to make sure we identify what it is that their response. What is their response? Why is it they don't want to come back? If they do identify that they're high risk, someone has a medical condition, and their healthcare provider is advising them that it's very risky for them at this moment to re-engage in the workforce because of COVID-19, then we want to engage that individual in an interactive process. We want to discuss with them what benefits may be available to them. For example, as Jen mentioned earlier, they may be entitled to the emergency paid sick leave, a federal leave. It might be an FMLA conversation we need to have with them, a Family Medical Leave Act. Or it could be an ADA leave of absence, and a leave of absence being a reasonable accommodation that we might want to consider for this individual. Again, these are just some examples of some of the items that we may need to discuss with the employee. Now, if they don't have a protected leave, then we want to let the employee know that that you understand that they may not want to return to work, but you have a business necessity to fill that position, and and unfortunately, if they can't come to work, then you're going to have to basically, if they're furloughed, then they're going to be terminated. But if they've already been terminated, just let them know that this position may not be available for you in the future, but you're free to apply in the future if and when the position becomes available. And you may want to advise them. It's best practice to advise them, because it is true. If you are offering them an opportunity to return to work with all these safety procedures that we've been detailing throughout the presentation, it's going to make their refusal to come back to work a little unreasonable. And if that's the case, it may affect their unemployment. So if one of the reasons why they're staying out is to collect that extra $600 between now and the end of July, that extra $600 or their unemployment in general actually may be at jeopardy because of the fact that you have made a position available to them, and that you've complied with all the reopening guidance in order to provide a safe working environment for them, and they're still refusing to return to work. So unless they have some other protected reason why they can't return to work, it could negatively affect the status of their unemployment. All right, some other items to consider. Some clients are asking us, well, can I bring them back to work at reduced wages or hours. They want to return. They want employees to come back to work. They want to reopen and get business up and running again. But because of the slowdown in business, they don't have the resources to pay everyone what they were paying them before. Now, obviously, we need to pay everyone, at or above the minimum wage, and in your state, in your region, as well as if someone is exempt, they have to meet the salary threshold. But other than those items, yes, you can reduce someone's wages. You can bring them back based on what the resources that you have available. Maybe you can't bring someone back full time. You can only bring them back part time. That's okay. Again, a caveat: if you did take out a Paycheck Protection Program loan, there are some requirements about bringing back your full-time equivalent employees, and also some requirements with regards to reduction in wages. If you reduce their wages by more than 25%, that could affect the forgiveness of your loan. So I would advise you to speak to your tax advisor. If you have an HR service that you use similar to an Alcott, I would reach out to them and for guidance, compliance guidance as what you can do, strategize with you in order for you to bring back your workforce, obviously at a wage rate that is comfortable for you and allows you to actually run your business. Keep in mind that there's also an opportunity for your employees that don't come back full time, or you can afford to bring them back full time. There's an opportunity for partial unemployment. So if they're working less than 4 days per week and earning less than the maximum 505 unemployment benefit per week, then they may be entitled to some weekly benefit to kind of mitigate some of the loss of income while they're working this reduced schedule. And lastly, there may also be an opportunity for shared work. Shared work is prior to the pandemic was a infrequently used program that most states had in place, New York being one of them, that allows an employer to reduce the work schedule of its employees and allow them to participate in a shared work program, part of the unemployment program, where they can receive some financial benefits to make up for some of the wages that they're losing because of the reduced schedule. Now, a difference here between the shared work and the partial unemployment is that there isn't a wage cap. So with partial unemployment, you have to earn less than 505 per week, whereas with the shared work, there isn't that cap. So if my work hours are reduced by 20% and I'm making $600 a week now, I'm still eligible to receive some benefit, even though I'm making more than the 505 cap that the partial unemployment is subject to. In addition, with the shared work, keep in mind that one of the requirements is that if your employees that were on benefits, such as health coverage, this benefit coverage has to be maintained while these individuals are on the shared work program. Shared work, it can be a bit of a challenge to set it up. It's not too difficult, but if you do have an HR service that you work with, we recommend you reach out to them. If they're like Alcott, they're probably assisting their clients in establishing a shared work program and assisting them in putting in all the weekly reporting that's required in order to keep the program up and running and get their employees paid. So if you have employees that do come back, some of the questions that's asked of us is, okay, well, what about benefits? Can I just put them back onto the benefits that they had before? These are great questions, and these are questions that generally speaking, I'm going to give you some best practice now, but you want to make sure you have a conversation with your carriers to see what their requirements are, because each carrier may have different rules. But generally speaking, you want to find out from your carrier, is there our requirement? For example, some carriers say that, well, for someone to be on our benefits, they have to work at least 30 hours per week. They have to work at least 28 hours per week, 20 hours per week, 35. You want to know what your carrier requires in order for that employee to be eligible for benefits on that program. So you want to make sure you speak to your carrier, prior to bringing back your employees, so that you're aware of what to advise your employees, and also if you are going to cut back on hours, you know who's affected. Is there any employees that you're returning that are currently on COBRA or that participated in the state marketplace benefits? Then they're going to need to cancel those benefits, the COBRA or the state marketplace benefits, before they go back onto the employer sponsored plan. Another question you want to talk to your carrier about is when can the benefits restart for your employees? So, for example, some carriers have a requirement that an employee has to wait 60 days in order to be eligible for benefits. That's something that you and your carrier maybe discussed when you're developing the plan. Some have it starts on the first day of the month following 30 days of employment. There are different rules for eligibility. So you want to know, is that rule going to still apply? Are they going to treat these employees coming back as new employees where they have to go through that waiting period again, or can they immediately go back on on the next first day of the month? You want to ask those kind of questions to your carrier so you have that information for your staff prior to recalling them to work. And as I just mentioned, the waiting period, is that waived? So these are all questions that you may want to ask. It's best practice. Have this discussion with your carrier as you are planning your reopening and your recalling of employees. All right. So finally, what we want to talk about is adapting to the new normal. That's a phrase that we're hearing a lot now, and it's, as I mentioned at the beginning of our program, it's fortunately, unfortunately, it's something that we as business owners and employers really need to consider, because some of these items, such as social distancing, remote work, they're not really going to go away anytime soon. And so, we're going to talk a little bit about that. All right. So one of the items that many clients have discussed is wanting to pay their employees that are on the front line or that are essential workers. They want to pay them some sort of hazard or appreciation pay in the form of some sort of bonus or a temporary increase to their wages. But you want to, although this is noble and it's definitely a big boost to employee morale, you want to make sure that you keep in mind that you need to have caution in this, because if you're going to pay someone an increase to their wage, whether it's via bonus or a temporary increase, it should be discretionary, because if it isn't, it can affect what's called their regular rate of pay. So, for example, if someone gets a bonus for creating a certain number of widgets, if you make 10 widgets per shift, you get an extra dollar per each additional widget. That is a non-discretionary bonus, because if they fulfill a certain task, they're guaranteed to get the bonus. So what happens is that extra guaranteed monies gets calculated into that employee's regular rate of pay, and then that affects their overtime rate, because overtime is 1.5 times their regular rate of pay, and any non-discretionary bonuses or wage payments, those get calculated into the regular rate of pay and increase your overtime liability to that employee if they work more than 40 hours. So any bonus or any hazard appreciation pay program you put in place, you want to make sure that in writing that employees are made aware that this program, this additional pay, is discretionary and that it could be discontinued at any time by the business. Okay. Obviously, you also don't want to discriminate against those who need to quarantine or use federal leave. So, for example, when you're putting together a hazard appreciation pay program, and only those that are coming to work are able to basically, they're the only ones that are able to obtain this pay or become eligible for this pay. You want to be careful that it's not discriminated against people that then advise you that they're going to be taking some sort of paid sick leave. And as we've mentioned throughout this presentation, communication is really what's key. So if you're going to put together a program like this, you want to make sure that all these items are communicated clearly and concisely to the employees, so they understand that these bonuses are discretionary and can be discontinued at any time. Another item to highlight to employees, especially when you're trying to, you want them to come back to work, is obviously talk about telemedicine. That's something that's probably going to, although it was an option before the pandemic, it really became a necessity during the pandemic, and it's something that we really expect to continue to see moving forward from our carriers, from our insurance carriers, and is actually, in many experts' opinion, is going to be an expectation So it's something that you may want to look to your carriers to see that this is an option for telemedicine. If you have an employee assistance program in place, remind your employees of the program. An EAP program, it's many outside HR services such as Alcott or others, provide this to its clients as part of their service contract. And so an employee assistance program could be an enormous resource to assist your employees during these trying times, whether it's with the pandemic or with the protests going on and things that are just increasing employee stresses in the workplace or at home. Most EAP programs can not only assist them with free counseling to discuss these items and help them with any stress they have, any mental health issues that they may have, but it's also a great program that can assist anyone in the home. Generally, it's usually not just the employee, but a lot of times it can assist anyone in that employee's home. And you want to highlight any other workplace benefits to your employees that they may have, any other ancillary benefits that they may have. Now, what are some policies that might be impacted moving forward? Interestingly, one of the bigger ticket items that we see is work from home. Many of our clients, prior to the pandemic, many businesses felt that their business it wasn't one that really fit the model for a telework environment. Unfortunately, many businesses, in order to continue staying open, staying in business, had to implement some sort of remote work or telework program. If not for all their employees, some of their employees, even clients within the construction industry, the cleaning industry, they have implemented some telework programs for some of their administrative staff or back office staff, and for many of our clients, they actually felt that these employees were even more productive while teleworking. One of the benefits of teleworking is obviously for most employees, they see it as an additional benefit that they have. Secondly, because it reduces, it's kind of a pro and con. It does reduce the physical interaction of employees in the physical workplace, but because it does that, there was we've seen, I'm sure the statistics will bear out once there are studies, but we've seen a reduction in the number of worksite complaints around themes such as harassment, discrimination, and those types of complaints, because and these employees are not around each other, and so a lot of HR departments among our clients have actually brought that up, that they've actually seen less gossip in the workplace and things of that nature. So this is something that we anticipate will be not only will we see more of teleworking moving into the future, but in order to keep the talent you have or to attract new talent, it's foreseeable that employees or prospective employees are going to have an expectation for some sort of remote work program. And so you may want to think about, obviously in the construction industry, you're very limited as to where you can have telework within your business. But for those departments or job titles that may lend themselves to teleworking more, in order to attract the talent or keep the talent you have, you may want to consider implementing some sort of telework program in the future, and speak with your HR team internally, or whichever HR service you work with, in order to come up with a compliant and proper remote work policy and agreement. Social distancing in the workplace, as we've mentioned throughout this webinar, that's something that that we anticipate is not going to go away anytime soon. Not only are your employees going to have an expectation of social distancing in the workplace for health-related reasons, but many of our customers and clients that we service are going to expect some sort of social distancing in the workplace whenever they come in to be serviced. I've read several articles about restaurants, for example, that they're actually anticipating having to reduce the number of individuals that they can serve at any given time, because They're going to work with fewer tables, because even when some of these restrictions are lifted, people aren't going to be rushing back to rub elbows in a restaurant. They're really going to be expecting some sort of social distancing moving forward. So that's something that not just within the workplace, but for the customers and clients we serve, they're going to have an expectation of that as well. Cleanliness and etiquette goes without saying. A lot of our employees are going to have the same expectations. We're already seeing OSHA discussing keeping some of the recommendations that have been made from the CDC, as well as some OSHA guidances that have been tweaked because of the pandemic. Some of these items are going to stay, and so we should anticipate more focus on cleaning in the workplace, more frequent cleaning, especially shared spaces and things of that nature. And with regards to New York State sick leave and attendance policies, one of the things that has come out of this is that many employers, you should look at your handbook and make sure that, most employers already had a policy that basically said, if you're sick and not feeling well, you should stay home. However, because of the pandemic, these policies probably need to be revamped a bit. There's some additional language, additional compliance language that should be in these policies moving forward. Because although COVID-19, hopefully is not something we're going to have to worry about long term, there's always going to be some sort of infectious disease that can affect a workplace, and we want to make sure that our employees are aware of what we're doing as employers to prevent the spread of infectious disease, but also what's expected of employees themselves in order to prevent the spread of infectious disease in the workplace. In addition, this September, there are going to be some changes to the New York State sick leave law. Now, when this pandemic started and our governor introduced some of the new laws regarding the paid sick leave for COVID as a COVID response, kind of hidden on the second or third page of those rules of that new law was a section regarding New York State sick leave policy, or excuse me, New York State sick leave law that's actually going to go into effect this September on a permanent basis. And that's going to require, it's going to be similar to those of you that are familiar with the New York City Earned Safe and Sick Leave. It's going to be similar to that particular law. It's going to require for most employers, it's depending on the number of employees you have, it's going to require you to give either 40 hours unpaid, 40 hours paid, or 56 hours paid of additional of sick leave to employees. And in addition to that, how much sick leave you're giving and how much sick leave is taken by the employees is going to have to be tracked and monitored, just like any other payroll data. It's going to have to be held for 6 years, such as so the same rules that apply to pay stubs, to wage statements, to time records in New York State under the labor law. The same rules are going to apply to sick leave. The amount of sick leave given and the amount of sick leave taken is going to have to be tracked, maintained, and those records are going to have to be saved for 6 years. So hopefully you guys are preparing for that. September is going to be right around the corner. And so you might have to maybe change your vacation, your PTO policies, whichever HRIS software you're using in order to track leaves. It may have to be updated to include this new codes for this particular sick leave. And if it is something that you outsource, definitely discuss this with your HR service provider. It's because it's something that is right around the corner, and you should be prepared come 9/1. All right, so thank you guys for your time. At this point, we're going to leave it open for any questions that our attendees may have. Going through some of the questions that came in. So one question that came in with regards to masks, whether or not someone that wears a beard and says that they can't shave the beard because of religious reasons, whether or not they still need to shave the beard in order to wear the mask. It sounds like that's what they're asking. This question has come up several times. Actually, OSHA there is guidance within the OSHA regulations that mandates that if an employee does have a beard, if that beard interferes with the seal around the mask in any way, then that employee he needs to shave the beard enough so that it doesn't interfere with the seal, or they can't work, or they're not going to be able to work in any workplace where a mask is required. And according to OSHA's guidance, that person can't even participate in the fit test until their beard is shaved to a regulatory, I guess, cut in order for that employee to properly fit the required mask. So again, I'm not talking about a face covering, a cloth face covering. I'm talking more about, if it's a mask that requires the seal, like an N95 or something a little more robust than a face covering.
I can elaborate on that because I had a client ask me a similar question yesterday, actually. So you will see in the New York State definition of what constitutes a facial covering, face shields are also included in terms of what's acceptable for a facial covering. So that would be a situation where if it is a religious accommodation being provided, the employer may be required to provide an alternative to the employee if it's not a beard that's interfering with their normal PPE for safety reasons, as Jose was discussing. So that's something that the employer should look into providing in a situation like that.
Right. So just to clarify, Jen, so for example, a respirator, if you're wearing something that requires a respirator because of fumes, obviously a face shield may not be effective. They need to wear
Correct.
something a little more robust than a face shield that has a respirator. So in that case, the religious reason for having the beard may not be enough in order to prevent you from having to wear the mask, because you can't.
Yes.
Right. Okay.
Yes, the face shield would only be appropriate for COVID regulation reasons, not for anything involving safety, such as a respirator or any other type of face shield for protection from construction work, not just a face shield that anyone working in New York State would have to wear due to COVID reasons. I have another question here about screening. It says, during screening, if an employee positively responds to one of the questions that indicates they need to self-quarantine and are sent home, are they paid for those 14 days? This is a great question. It's a little complicated. Our favorite HR answer is it depends. And really that's because the employee actually has a few compensation options. I would say this also applies if you're doing your contact tracing. If you're not an essential employer, you should be sending employees home who are found to have had close contact with someone who's tested positive for COVID, even if they're not symptomatic. And in that scenario, as well as an employee who's sent home due to failing the health screening questionnaire, there's a couple compensation options. So the employer should notify the employee that they may be eligible for the emergency paid sick leave, like we talked about earlier, and what's required to qualify. So if it's an employee who is not symptomatic, they still would have to provide documentation to support that they need to quarantine, which they could get that from a doctor. And one of the other options, if they can't do that or are unwilling to provide supporting documentation, the employee also has the option of using PTO time to cover the absence. Or if you have a policy that requires employees to use PTO for an unpaid leave of absence, you could implement that as well. But obviously use caution in that type of scenario, as the employee is being required to stay home. It's not voluntary. So you might want to reassess the requirement to use that, but obviously allow them to use PTO if they would like to. And then the third option is if the employee is out of work due to COVID related reasons and the leave is otherwise unpaid, they would actually qualify for state unemployment and the federal pandemic unemployment assistance, that extra $600 for however long they're out. So they would just need to go through the regular application process for unemployment, as the 1 week waiting period is currently waived. They would apply for it that way, and they would just have to expect that there would be a delay in their payment. As we're seeing, the delay is not as bad as it was, but it's certainly still there. So they could expect, 4 to 6 weeks of a delay in terms of receiving that payment.
Okay, I think we have time for one more question. The question is, whether or not employees can be disciplined for not following various social distance guidelines. This is a common question. With regards to the requirements set by the state, with regards to any policies that you put into place in order to provide your employees with a safe work environment, if it's a company policy that is violated, that individual can be disciplined, and best practice would be to follow whatever your normal progressive discipline policy is in your handbook, or policy that you use. You need to. A lot of times when it comes to the pandemic, a lot of times we kind of look through things as these, I say this, these COVID-19 glasses, and so we start thinking that we have to analyze things differently. To some extent, yes, but in this case, like in many others, it's a workplace policy that is put in place for a valid reason, many times required by state, local, or federal law, and a violation of that policy is tantamount to just a violation of workplace policy. It can subject the person to discipline. And so the best practice would be to follow whatever your normal discipline procedure is for a violation of any company policy. All right, so that is all the time we have. Again, thank you to the Construction Exchange for allowing us the time to share this information with you today. And as we mentioned at the beginning of the webinar, we will be providing the attendees with a copy of our presentation along with some additional resources. You'll have our contact information. If there's any additional questions that you may have that we weren't able to address today, please feel free to reach out to us. And to all of you, stay safe and healthy. And thanks again.
Jen and Jose, thank you so much for your time today. We really appreciate it. And for everyone else that listened to the call here, we do have some more COVID-related seminars coming down the pipeline. So just be sure to keep an eye out on our website and our social media blasts for the dates and the topics on those. So thank you all very much for your time today. Have a good day.